Welcome to
back
the podcast.
to the podcast.
Welcome to the Visceral Voice Podcast. Welcome to the Visceral Voice Podcast. I'm your host, Christine Schneider. Through this podcast, I aim to bring you the most current, up-to-date research on voice science, function, pain science, movement, and everything in between. I am on a quest to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, a movement specialist, and a manual therapist. Join us as we strive to provide current, knowledgeable, creative, and compassionate information to help you restore, regain, and create happiness and success on your vocal journey. Hello, everybody. Welcome back to the podcast. I am so thrilled to be joined by our guests today talking about hypermobility. Mairin Srygley is a multifaceted singer, actress, entrepreneur, and voice-speech therapist based in Baltimore, Maryland, U.S. She is passionate about advancing justice in and through the arts, challenging elitist traditions of classical music, and sharing evidence-based information about vocal health and specialized knowledge of hypermobility and the voice. An avid learner, listener, and problem solver, Mairin draws on her varied life experiences in the arts, language, education, research sciences, and healthcare to bring her best self and skills for every colleague and client. You can learn more and contact her via her website, www.massvoice.org. Jamie Terry is a Yoga Alliance certified yoga teacher and therapeutic movement coach with over a decade of experience and more than 1,500 teaching hours. She offers personalized whole person support to help you move with greater compassion, curiosity, and confidence. With a special focus on trauma-informed care, hypermobility, and accessible strength training, Jamie creates inclusive, empowering spaces for all bodies. Living with hypermobility spectrum disorder herself, she blends professional expertise with lived experience. Whether through one-on-one coaching or online group courses, her mission is to help you build a deeper, more supportive relationship with your body through movement that heals. Jamie and Mairin, thank you so much. Welcome to the podcast.
Thank you.
Thanks for having me.
Yeah, thanks so much for being here. So I would love to start with how you each got interested in working with hypermobility in your private practice, in your clinic, in your private movement studios. What brought you there? What got you interested in working with those who are hypermobile? Jamie, we'll start with you.
Okay. Well, I was a dancer and I was born in 1983, and I don't know if hypermobility was talked about much in the 80s, but it certainly was not talked about in my ballet studio. I was in a pre-professional ballet company, and looking back, I remember ballet was so difficult for me because it required so much holding and so much strength. And I was super bendy and stretchy, and I could get into all the modern dance and the lyrical and the jazz, but ballet in particular, I really, really struggled because it required the flexibility and the strength. And I trended on the flexibility side. Youth has its advantages where we can kind of do things with our bodies and it may not show up for a while. And in my early 20s, I started experiencing a lot of seemingly disparate problems that nobody could really connect the dots. It was just general dysautonomia. I was told to sleep more, reduce my stress, but nobody really gave me any language that felt whole.
Mm.
Um, went for a decade with these issues that I just could not fully sort out. And then it was actually just about 5 years ago that I was working with a movement coach, and she said to me, I think you're hypermobile. So my knowledge of hypermobility is actually quite young. I feel really honored to be speaking today because even though I've lived 41 years in a hypermobile body, my like intellectual knowledge of it is quite green. But there's nothing like a personal need to mobilize you, or at least it did that for me. My
Mhm.
personal needs mobilized me into wanting to understand. And then I had a boss once who said, if you find something good, give it away. And I just, I have a service-oriented heart. It's not something I take credit for. It's just the way I'm built. And knowing what was helping me, it was like I couldn't not share it. And as the universe does, when we open ourselves up to what's next, it just so happened that without advertising it, all the people that were coming to me were also hypermobile. So it's just been a really organic process of discovering through my own lived experience how something really feels from the inside out. And while every person's experience with hypermobility EDS is unique, I think there's a crossover understanding, right? Like we're in the same club, and having having access to that club, I feel like has helped me serve people, even though, like I said, intellectually, I'm pretty new to all this.
Mm.
It's not like I've really known about hypermobility my whole life, but I'm on fire about it. And so I'm, I just want to help.
Yeah, and you are very knowledgeable about it, and you do help so much. I had mentioned before we actually started recording, Jamie has shared a hypermobility inventory or an intake form with our study group that a lot of it I use in my form now, and I've shared it with other voice teachers. So, and then continuing to add insights into what we were talking about when also including what might be happening with someone in that is hypermobile. So we have learned a lot from you in our study group. And so though you consider yourself green, we are really grateful. You are not. You are very, very knowledgeable. We're really grateful for that and grateful for you and for your service, as you said.
Thank you.
Mairin, what got you interested?
Yeah, Jamie, thanks for sharing your story. Like you said, if you're hypermobile, you have these like overlaps with everybody else who also identifies that way. So each story is unique, but there's definitely a community in that experience. And my story is similar in that I like looking back on my life, I have so many health experiences and day-to-day experiences that overlap with the hypermobility as a symptom and also as like a feature of a larger health syndrome. And I didn't know that what hypermobility was until my hairstylist, I think it was like 2019, told me. And I'm like, a hair. So, and this is not I've been going to physical therapy for years at that point, like doctors for digestive stuff, like all kind chronic pain in different parts of my body, so many things, and trying to figure out why do I hate exercising so much? And, and so, like, it all came to my hairstylist telling me, "Oh, it's interesting that your health issues overlap with mine so much because they're not actually supposed to be that common. Have you ever thought about being hypermobile?" And I'm like, "I don't know what you're talking about." And so that was also the moment where I was like, okay, why have I never heard of this before? Um, how can I learn as much as possible? And I think that many people feel green, as you mentioned, as you described, because there's not a lot of research on it. And um, a lot of the research focuses on dancers, right? So in the movement community, thankfully there is some there, but kind of, the presence of it, not necessarily the complications that relate to it. And so I think even people who have done some of that research for years are still limited in their information as well. So I'm with you in this feeling of, do I know a lot? But I also just anytime I have information, I want to share that information, especially if it's not widely accessible in the spaces where I would hope it can be one day. Like, can more practitioners, can more providers to everyone, whether you're a performing artist or not, have this information one day? I really hope so. Can they learn more so that they can also start providing that before they have to like go through tons and tons of doctor's appointments? The number of hours that people spend trying to get to this diagnosis is immense, and I hope that that can reduce in the future. But for now, like we have the information, so sharing that is so important. Um, and yeah, I mean, that's really how my story started is like, thank you, Sam, for as you're cutting my hair, suggesting hypermobility to me and really changing my whole health path because that was the moment at which I could also then improve my health and my participation in physical activity and understand like how to work with my body and stop fighting it in so many ways. And I guess we can get into that, the like syndromic features of hypermobility. But yeah, it's definitely been a journey, and I'm really excited to be here. And also, yeah, honored to be able to share with your listeners, Christine.
Yeah, thank you so much. And Mairin and I, for a few years now, have, I think, gone back and forth with various research, or is there any research on this? Is there any
Uh-huh.
research on that? Do you know anything about that? And so I'm so, so grateful for your background and your interest and your sharing of that information because, as you said, it's not highly researched, and anything that we can kind of get our hands on and
Hmm.
hear about and see what's happening and what's being discussed and see what's happening clinically as well is really helpful.
I'd
Yeah.
like to
Yeah,
say something about research if that's okay.
of course.
Yeah, so um, I've been thinking a lot of, well, I'm always thinking a lot about research, but specifically with regard to hypermobility, well, and even, okay, let me back up. Professional athletes of any kind often have access to research and tools much earlier. And
Hmm.
that makes sense because in the performance world, there's a need for that, right? But it can mean that there's big gaps. So it's amazing that we have so much research on dancers, but the professional life, the performance life of a dancer does not usually go into perimenopause, menopause. So that's a big gap.
Hmm.
The performance life of a dancer often starts early. I mean, even though I struggled with strength in ballet, I was still very strong. I have pictures of being in sixth grade and having a six pack. Like as a young
Wow.
teenage girl, having like immense strength, that is going to be quite protective for quite a while.
Hmm.
But what happens after, what happens with folks who did not have that early athletic training? What happens with hypermobile folks as they experience hormonal changes and trauma? And dancers have some built-in protective measures in that especially as you get higher into the professional levels, you've got nutritionists and you've got physical therapists and strength trainers and years of muscle building underneath you. That is a very different reality than like your general population person
Yeah.
trying to figure all this stuff out alone.
Yeah.
So yeah, the research gap is real and a big deal.
Mhm.
Yeah.
I do want to mention to the listeners right now, there is a website being built as we speak. Marita Stryker is leading that, and it is called Chronically Singing. And that is where we can go as health practitioners, as individuals, as teachers, both to add our information and research and also to go and explore what is happening in the field, how we can make changes to various aspects in the field, different things we could shift in the voice studio, which we'll talk a little bit about today, different things that we could shift in a choral setting,
Mhm.
etc. So, and it's Ehlers-Danlos syndrome, hypermobility, POTS, and various other chronic conditions that will be on that website. So please stay tuned. It is actually, I think, launching this week or next week.
It's already running.
Very
I went
soon.
on
Is it
there
already
today.
running? Ah, it's
Yeah.
already running. So please stay tuned. Add your stuff. Add your information. I'm just so grateful to Marita's a very good friend of mine, and I'm just so grateful for her and her work and putting all that together and the heart that she has for it. She wrote her dissertation on POTS, and
Hmm.
just has so much love and care for the chronically singing demographic. So
That's amazing.
stay, check it out. Yeah, stay tuned. So, what are some common challenges that you see with your hypermobile clients and students in your clinic? Mairin, we'll start with you.
Yeah, sure. So I think that there's kind of two populations I might work with, which is like clinical setting in terms of voice users, and that could be speaking voice challenges, or singing voice, or also postmenopausal or aging voice concerns. And so they're coming from an ENT or laryngology office saying, I have this problem, a lesion, changes in the voice that won't get better. And then also singing voice students, right? And so people that like have not had a clinical diagnosis and they have already been singing for a while or they're singing for the first time. So I'm seeing people like in a lot of different situations and backgrounds. And I think that more people than we realize are hypermobile.
Mm,
Um, I my research has focused primarily on like trying to um, get a better sense of prevalence among voice users, particularly singers, of hypermobility, and getting that training in like how to screen people for hypermobility in an accessible way. And I'm excited about sharing some of that research later. We can discuss that. But it's been amazing how many people I've screened for hypermobility once they mention certain concerns, fatigue, excess tension, digestive problems that can result in reflux issues that are not necessarily resolved with proton pump inhibitors or other prescription interventions for reflux. Um, I think inconsistency also of your voice, and so even a very skilled singer, they have technique and they can sing very well, but it's difficult to consistently perform the same way every day, um, independent of any like explicit health issues, right? So it's not like they suddenly have the flu and they can't sing. It's like, I feel generally fine, but why doesn't my voice want to do what it did yesterday?
Mm.
Um, and I think breathing challenges, right? And that relates in some ways to tension and like muscular imbalances. So, kind of that full body view and how it relates to the voice. Those are some of the biggest things I see just like day to day across most voice users, so singers or speakers with hypermobility. And
mhm,
I think it's important to point out like symptomatic hypermobility and versus asymptomatic. And like when that, you all can probably define that too, but in from the research I've done, that is distinguished in the medical field by like complicating factors of hypermobility. So chronic pain, and digestive issues and potentially respiratory issues, and that like widespread musculoskeletal concerns, whether that's like subluxations of joints or actual dislocations of joints. Um, and so some of the people I see would be considered asymptomatic hypermobile, and they've have it for years. So there's like very mild evidence that it's affecting their voice. But most of the people I see as adults are symptomatic, because I'm usually seeing them in a clinical setting. And then even the singers, they're coming because they're like, I just want to learn how to sing better and I don't know why it's working. So there may be even more people out there who are, using their voice in some way that are hypermobile but aren't having as many issues. And they might be younger, they might be more fit. Jamie, you mentioned earlier, like having a history of exercise and more muscle mass and strength can help over time reduce the impact of or reduce the chances, I think, of developing a symptomatic experience with hypermobility. So the people I'm seeing are definitely experiencing more challenges. Um, but yeah, it's definitely slightly different for each person, but a lot of overlap.
Do you use a similar intake form for your clinic and your voice studio?
Well, there's a line. I think that the answer is yes and no.
Mhm.
Even with my non-clinical clients, so they're coming in, they're like, I want to do singing voice lessons. I will ask if there's any medical information that they think would be helpful for me to know, but
Mhm.
it's not something that they're required to disclose. And if something I'm noticing in the course of us working together would prompt me asking about a medical feature of their life or their body, um, they do not have to disclose that to me, right? Because it's not a medical setting. So I do think that there's a line. In the
Mhm.
clinical setting, yes, like I'm asking about their whole body wellness. And there's some things that like I don't need to know if you had necessarily need to know if you had toe surgery 20 years ago. But if they think it's relevant, they can tell me as much as they want and are willing to tell me about their health history. Um, but I do inquire about digestive, respiratory, surgical histories, um, dental history, and usually I will screen for hypermobility like very broadly, and then if there's something to suggest that they may be unaware of potential hypermobility, then I will go through the more specific like screening process for that. But if it's non-clinical, it's not the same process because I'm not like supposed to be privileged to that information in that setting.
Mhm. Great. Thank you. Jamie, what are some of the common challenges that you see with hypermobile clients?
Well, Mairin, I appreciate that you offered some of the concrete symptoms or experiences that we run into. Um, I went a slightly different direction with the question, and so I'm glad that you highlighted those. Um, One of the biggest challenges I think with the people that I work with is first of all that they don't know what hypermobility is, and they come into body care with frustration, exhaustion from seeing other practitioners and not really knowing where else to turn. A lot of times when folks get to me, they're at the end of the line, so to speak. They feel like
Mhm.
they've been to everyone else, they've been to physical therapists, and I might be sort of the last stop that they can handle because they've been gaslit or they're just so tired of being a project. And so folks just not knowing the full scope of hypermobility. Like you said, Mairin, it's so much more than just my joints are bendy or my joints are unstable.
Right.
For folks who may not know on a very basic level, the kind of fountainhead or the headwaters of hypermobility and EDS is a difference in collagen. And collagen runs through your entire body, tip to toes. It runs in and out of all the systems, including your brain and your digestive system. It is a full, it has the potential to be a full experience that goes beyond just, oh, look what my elbows can do, you know?
Yeah.
And so that that's not just a physical challenge, but it's a psychological one, it's an energetic one, it's a social challenge. People feel like they're isolated from their lives and their activities. So when they come in to see me, that is the biggest thing that I feel like I want to attend to first is like, do you know what this is? Do you know what you're living with and how it deserves to be witnessed and cared for? And I would say along those lines, another challenge that I run into is folks not understanding how pain works. That there
Mm.
are pain is always communicating a need, but it doesn't always mean that we can't move or shouldn't move. And that is so counterintuitive for people. So just the relationship with pain, understanding pain, understanding that there are different flavors of pain, right? Like we have different flavors or styles of love. It's the same way with pain. And can we develop some sort of pain literacy about what it might mean? Um, I've got two others. The third one is a fear of moving differently. That could
Mhm.
mean doing less. That could mean doing more. Depends. I feel like I see the two ends of the spectrum. I work with hypermobile folks that their nervous systems are in such a state of being upregulated that to do less is very psychologically and energetically bothersome for them. And then other folks who have been dealing with so much pain and so much fear and so much instability that they feel like their best safety is to not move at all. And so I would say that's a challenge in the folks that I work with is just can we can we open up new additional possibilities of movement?
Jamie,
Yeah,
before you say the last one, I love that you brought that up because in the singing world and like voice user world, I am always talking to people, especially people who are hypermobile, about we're deactivating some of these parts of your body and activating these parts of your body, right?
yes,
And even in my own personal experience, like my trainers being like, your glutes are not turning on. And, like, well, I don't even feel if my glutes are or not. And so learning that, right? Like, what does it feel like to activate the parts of our body that are useful and would help us make our movement or like, and the movement even internally in our throat more efficient and more sustainable. So I love that you brought that up because I think you're right. Like, it's so hard if you are overusing parts of your body and they're over recruiting to let those go. And how do you get your brain to tell those parts of your body to let go? It's such a balance.
yes,
Um, and I think also the time that it can take to do that, right? To communicate with your nervous system and the pain education is so important too, because it relates back to that as well, right? Like how are we thinking about it? And you're really making me think about like the anxiety piece being such an important thing to talk about as well. Like as a person working with the body, as a person working with the voice, our scope still relates back to that psychological piece and how counseling is so important. And knowing when to refer, right? Like, do they have a psychologist or therapist that they can work with? But
yeah,
also the work we can do to help them work on managing that pain on like a mental level
yeah.
is makes a huge impact. I'm sorry, I'll let you keep going, but I was
No,
just wanted to
great.
add because it's such an important point. Um, yeah, that I think
Yeah.
it's important to highlight.
And I've got sort of other things in the background related to what you're saying that hopefully we'll unpack later too. So thank you. I think the last thing I would say just really again echoes something you said, which is the breathing. Um, so in my world, that's not so much about voice, although through Christine, I'm learning about what the voice can tell us about how the body and how the nervous system is doing. Um, but when folks come to me, it's more so, can you help me with pain? Can you help me with mobility? Can you help me with strength? And
Mhm.
so the my sort of inroad to breathing is a little bit about what you said, is like, is there so much tension around the diaphragm that it can't move? So now the rib cage can't move. So now the shoulders can't move. So now the neck is just so tight all the time. Does the diaphragm know how to connect to the brain? Is there enough safety inside the system to allow for breathing to even happen? Is there enough
Mm,
safety in your home? Like where might you have a safe environment so that breathing can even bubble up to the surface? And this is a really specific factor, but I do want to mention this for any of the like strength trainers who might listen. Part of the big challenge with breathing in this population is that, okay, so the diaphragm is really big and it's something that we can grab onto for stability. The challenge is the diaphragm can't be the stabilizer and the respiratory engine at the same time. So, Mairin, earlier when you were talking about there are places where we've got to let go and then places where we need to turn up the activation, the diaphragm can be a really tricky place to start that like unwinding, to learn, okay, well, if it's not the diaphragm that I'm grabbing onto for centralizing stability, what is it and how do I feel it? And then while I'm doing that, I also need to unlearn the diaphragm as the stabilizer and
hmm
engage with it as the respiratory engine. It's so much. I tell my clients it's like you've been riding a bicycle backwards and upside down, and now we're going to flip you upright and teach you how to ride forward all at the same time. It is
Yes.
not for the faint of heart. Hypermobile people, EDS folks, like y'all are superheroes, and this experience, most people could not live it. So, yeah.
Yeah. You're so right. You're so
Yeah.
right. And it sounds complicated, right? Like we're the people as the providers that have to think through all those tiny pieces and like, okay, how are we gonna get this happening? How are we gonna get this happening and build that together? Because like cognitively also, like you mentioned, people living with chronic illness, chronic pain, it's already so much mental load.
Mhm.
So we can help facilitate that plan and that happening without the person who's in
Yes.
the like healing state or like learning state having to be overloaded with all the tiny little bits.
Yep.
Um, and so that can be so important too for providers to remember is like and for people listening who have hypermobility, like find your care team because doing it by yourself is not going to be sustainable necessarily, right? Find people like you, like Christine, like myself, like so many people actually in the country, thankfully, providing the services that will be there for you to put these things together.
Mhm.
Yeah, we can help folks carry that load. You know, we can carry
hmm
more together than we can carry on our own. And all three of us, we're in this world all day, every day. So as I describe it, yes, it sounds complicated. And to some degree it is, but I also think it's really beautiful. I like the puzzle. I don't like that people are living in pain, but I like the puzzle. And
Yeah.
and so we have, this is, you know, this is like our calling. This is our passion and it's what we're here for. So while there is complexity to it, it's something that I am happy and comfortable holding, if that makes any sense.
Yeah.
And I find that
Mhm.
that can relieve pressure off of my clients of like, oh, somebody else can take stock of all these details because I am
Yeah.
done.
Mhm. I think,
100%.
Maren, when you had mentioned the nervous system and someone coming in and potentially part of an initiation of that is the ability of the practitioner to listen and have time to listen.
hmm
And when someone feels listened to, their nervous system can start to regulate a little bit. And with that, I think that we are in such a remarkable place in our practices where we have a little bit more time than doctors do. I mean, a lot of them are seeing like 20 or 40 people per hour. Um, but I think we can also help. Marita has talked to me a lot about this of being able to help educate our healthcare practitioners that we're working with on
Yes.
various conditions and having those conversations. And luckily, I have colleagues in the field in laryngology and otolaryngology who will sit down and have dinner with me and have conversations and listen and we'll learn from each other. And I think that that's really one incredible that they're willing to have those conversations and listen to me because I am not a doctor, but also what we're able to help provide because we are able to spend a little bit longer with somebody and we are able to hear what they've been going through. And a lot of this demographic is tired of having to educate their healthcare providers.
Yes, right.
And, and it's like, I don't want to go to one more person or one more doctor
Mhm.
because I don't want to have to tell them the same story that I've told them. I've been
Yes.
saying to 15 other healthcare providers.
Yep.
So
Yes.
being able to have these conversations, with us is in therapy and in therapeutic settings, and then being able to have the conversations with the medical practitioners in support of our clients, I think is really impactful.
Yeah. When I first kind of really understood, oh, okay, the universe is like taking me in this direction and this is going to be the population now. I was a little worried about self-disclosing too much.
Mm,
Self-disclosure is there's a fine line in care, and some people appreciate more of it, some people appreciate less of it. What I consistently hear from my clients is that they're so relieved to find a care provider. And I am not a doctor either, but they're just so relieved to find that listening ear and that care provider who can relate, even if there are still aspects of their experience that I don't fully understand because maybe they have, a particular symptom that I don't have. There's still so much of their lived experience that I can relate to. And there's just an understanding that
mhm.
goes, it's less words.
Yeah, and it makes me think too, in the like clinical world, evidence-based practice is like a hot term that everyone is saying, well, everything you do has to be evidence-based, evidence-based. And I agree. And I think that sometimes though, providers forget the like three elements of that. One of them being like empirical research, excellent, great, I believe in it, love it. The clinical judgment, right? Like your own experiences and the person in front of you, their experience and their expertise on themselves. And I think that, that's one piece that we can listen more as providers, always be listening. And like we're saying, it's such an important part of this and serving the people we work with. But then that clinical judgment, not just being about the experience you've had with clients, but your own experience. I think that we gain clinical judgment and judgment gain that information through our own journey through health systems and through like learning about our own movement capacity
Yeah.
and learning about our anatomy. Like it's such an important part of that judgment piece
Yeah.
that we don't just have to draw on like what everyone else is doing or experiencing, but draw on our own personal experiences. So I have found also, Jamie, that disclosure, self-disclosure can be really helpful. Um, and and I've had experiences with trans voice clients as well, right? Where they're like, "Oh, I'm having top surgery. You've had a breast reduction too?" Like, I hope
Oh,
that's not too TMI right now, but it's like,
wow.
wow, they know that I've experienced something so similar to them.
Yeah.
And it's huge how that changes the dynamic. And we're all saying it in different ways, but I think people want to feel that personal connection. Um, so that they're not just a checklist, right? They're not just a person
Yes.
that you're like, okay, I'm going to document and like I'll try to help you. No, but like we're invested because
Mhm.
we can understand on a certain level of like what they're experiencing and remember what it's like not to be heard.
That's right.
And that's like one thing I think about with humanity. Well, it's one thing that all humans want. We all want to be heard. And
Hmm.
it's, so hard when you're in an experience sitting in a room and you're like, I really don't think this person listened to me at all. They really don't know what I mean. It's a very difficult situation to be in, and I think that's one of the most powerful things of the work that we all do is making that like space to listen to others and make them feel heard and cared for.
Hmm.
Finally. And I find
Finally.
that to be so powerful. And one of the most like personally rewarding things is to have that like it's an intimacy that you end up creating that can be so hard to find day to
Yeah.
day and especially in the healthcare system.
Yeah.
So yeah, I love that we're
What's
talking about this.
what's more intimate than healthcare?
I know.
Yeah.
It's so vulnerable and yet it can be hard to allow like want to be vulnerable with healthcare practitioners. And healthcare and the body practitioners, right? Like, because I think I don't mean to draw that line between healthcare and the work that you two do as well, because it's still so important. And that maybe is a follow-up question or topic of like that holistic care. That's what I'm always sharing with my practitioner or clinician colleagues is like, we can refer people out to like outside of the medical system and how impactful that can be. But I will pause there.
Yeah, I mean, that's how it is in New York, where I've gained so many friends through being colleagues with speech therapists and with laryngologists and GPs, and just being able to be part of the team that people are
Yeah.
referring to. I'm just absolutely so grateful. And I've certainly learned a lot in the clinical setting. And I learn a lot from my study groups and conversations like this, where, we're all coming together wanting to provide the same thing and learning from one another to do the best that we can for the individual that's in front of us, which is very important and very powerful. So what are differences that you might incorporate with someone who comes in who's not hypermobile and someone who is, kind of like modifications that you might make, or just kind of a trajectory of what you would do with someone who's hypermobile versus what you would do with someone who doesn't seem to have hypermobility or any kind of comorbidities? Jamie, let's start with you.
Yeah, sure. Um, so I've been thinking about this a lot, and I could be wrong, but I kind of think that things that help hypermobile people also help folks who don't have hypermobility. So this might be a little bit disappointing, but I actually don't do things that much different. What I will say is that I would loosely anticipate that someone who does not have a connective tissue disorder might progress towards their goals faster.
Mm,
They might um, they might not need as many references, and I'll explain what references are in a moment. We might we might explore greater ranges of motion. But other than that, I actually don't know that I would do a whole lot different. So let me go back. I progress my folks with connective tissue disorders, whether that's hypermobility or EDS, we progress at the pace of their nervous system. So I tell when folks ask me who don't specifically work with this population, just general strength trainers who say, "Hey, I'm working with someone now who's hypermobile. What's one piece of advice you have?" And I would say to them, whatever you think going slow is, cut that in half and then even go slower. um, and use references. So if you were to stand in the middle of a room and do a body weight squat, where the only thing that's touching your skin is the floor, that would be low reference. You don't have any biofeedback about where your body is in space other than the air around you, which is not doesn't communicate much, and the floor underneath your feet. Whereas if I were to work with someone with hypermobility and they want to do squats, which I would say is like probably pretty far down the line, we would probably do a lot of other things first. But when they're ready for that, we might have a band around the knees and a ball or a yoga block in between the knees. So now the brain is attuned to, oh, there's my knees. Oh, there's
Mm.
my legs. I can feel, there's a quote that I love from Buddha that says, the foot feels the foot when it feels the ground. It's like our body needs something to feel itself against other than air.
Mhm.
I might have someone put their back up against a wall and move down into that squat. So now we've got the wall behind the back. We've got something between the knees, something around the knees. I might put something under the arches of their feet. These are examples of references. And with folks who have hypermobility, it can be so hard to know, where is all my stuff? Where am I in the world? And how can I feel my body from the inside out, outside in? Mairin, you were talking about earlier, like, how does my brain not know how to pick up the phone and call my glutes?
Yeah.
It's like, well, we might need to introduce more communication to help that conversation happen. So I use a lot of references, move really slow, move at the pace of the nervous system. I have heard that general best practice is to progress a movement plan or a strength plan roughly, 6 to 8 weeks. We can up it. I don't follow that.
Mhm.
We just go week by week and see how are we doing. Um, a couple other things I would say, again, this is way down the line, but I really encourage folks to use weight machines. In the movement world, I think there is this preference for compound movement because the thought is, well, this is more like how we move in life. And sure, there's truth to that. But weight machines at the gym can save people a whole lot of energy, and it can help them pick up the phone and call a muscle rather than trying to pick up 10 phones and call 10 muscles all at the same time. It's like I work in layers. Um,
And the
and
machines provide reference.
they do. They
Yeah, they
do.
provide more reference.
When you
Yeah.
sit,
Mhm.
if you sit on a leg extension machine, now you've got fabric behind your back, underneath your bum. There's so much more there for you. Yeah, there's just so much more communication there.
Mhm.
And then last thing I'll say is I will say this is a difference with my hypermobile folks. I encourage them to get in water as much as possible.
Mm.
Water is good for everyone. A lot of people love swimming, a lot of people love water, but I think water can be really therapeutic for this crowd on a whole bunch of levels. When water is moving past your skin, we have that feedback of like, oh, this is where I am in space. We get a little bit of pressure from the water, which can provide some nice containment, but yet we get a break from gravity, which can feel like, oh, such a relief that I don't have to work so hard to hold myself up against gravity. Um, I am not a swim coach and I don't have a pool, but it's just something that I recommend that I think really helps this population.
Mhm.
Mm.
Yeah, I have a number of hypermobile people who walk the
Yes.
lane,
Mm.
who walk the lane, and then we also have sensory deprivation tanks, so like float tanks.
I
Um,
I am not so sure about those yet.
yeah,
I thought of that too, Christine. I love it. Like,
I love it too. I am somewhat hypermobile, but I'm on the asymptomatic form of hypermobility. And I love float tanks. Usually my clients who do them are more rheumatoid arthritis or something in that vein who have tremendous outcomes. Mairin, you like them?
I do. I think that nervous system regulation is actually really important for people,
Mhm.
well, for everyone. Like you said, Jamie, a lot of the things we can recommend are great for all people, but I think especially for people with hypermobility because anxiety and related like psychological challenges are so prevalent when you have chronic illnesses. Uh, so nervous system regulation is really important, and I think that float tanks are one thing you can do. I don't think of it as sensory deprivation. That's like not what I ever say to people. They
Mhm.
might hear about it as, oh, you mean sensory deprivation tanks, and I'm like, no, it's not about that. It's about the float tank. It's
Yeah.
about the salt in the water completely removing any effort from your body having to when you're floating, right? Because when you float in other water that's not salinated, there's some like effort. It's mild. So I love also the pool. Um, but the salt removes any effort at all, and you can't do anything but float. And I think it's very powerful because your body gets to stop thinking about holding itself in a certain position. And you can also you know, put yourself in certain positions using supports. Like they can give you floaty devices to help you like keep your knees in more of like a frog position if you want to like have sort of an open splayed I'm like gesturing as if people would see if you're like lying on your back in the water and like if you have your knees bent open or if you're lying on your stomach you can get a floaty device to have your head supported and put your knee up on one side and you can get yourself in different positions that might feel therapeutic or helpful. And then also this time to just do nothing. When do we ever get
Mhm.
to do that? I think that along the lines of anxiety being prevalent in people with hypermobility, when do our brains get to turn off? When do we have quiet spaces to think about the things we do want to think about and reflect on, right? And no like notifications coming in, no one coming into the room and trying to talk with you, no planning dinner or like looking at the laundry that's sitting there you have to do. You get a time to just be there. So I actually took my mom. My mom now knows that she's hypermobile, explains her whole health history. She didn't know until she was in her 60s when I was like, I'm pretty sure I am. So also what happens when you find out. I took her to float therapy and I was like, what did you think? And I spend my time in float therapy lying there. I like the quietness and I like to turn on music and I'll like bounce around. I like push myself off the walls and it's so nice. My mom was like, well, I don't know if I would do it again, but I did pretty much just talk to myself for the whole hour. So she obviously had some things she wanted to
Oh my
think
gosh.
about and work out. And I think that so those are kinds of things coming back to that holistic approach is like providing those suggestions to people and characterizing in a way that's like it doesn't have to be for sensory deprivation. And they have open float tanks that's a whole just a room basically with a pool in it. I've enjoyed
Mhm.
that more than the
That's the
closed
kind I've done.
tanks.
Mhm.
Yeah.
So I think it's worth like describing what are the actual options. And I think also acupuncture is an alternative. It provides another space where you don't move. You chill, right? You're not supposed to be like up and about talking to anyone. You're with yourself for a while and can be a similar opportunity for nervous system regulation. Um, so I can stop there, but yeah, I think float tanks and acupuncture in a similar way are really useful.
There's also
Um,
something, I wrote a paper on it in massage school, so it was 100 years ago. But there's something called Watsu, which is water
mm,
shiatsu.
Yes.
So I never got to practice it because it's very hard to find a pool in New York City. But apparently, if you live in Florida or California or something, then you are more likely to experience Watsu. But I don't know, that's interesting. I love that you brought that up, Jamie, because I saw your post in the group and shared it in my story on having folks with dysautonomia kind of hop into a pool and
Mm.
see what can happen with the pressure of water and the resistance that water can provide. So I'm glad that you mentioned that. So, Mairin, do you do anything different? Do you do any kind of modifications or anything with someone who's hypermobile versus someone who is not?
Yeah, I think each session with each person is personalized. So, as Jamie said, there might be some things that I'm recommending to multiple people, regardless of presence of hypermobility. But I think that what I see more often is excess muscular recruitment. So, like hyperfunctional voice use, um, and anxiety, neurodiversity. And so, like, that not necessarily being a disorder, right? But like a different way of processing information,
Yep.
which can then relate to also anxiety and like hyperfunctional nervous system. Um, and I think all of those things end up changing how I work with hypermobile people. It's just that they are experiencing those things more often than others. And I also think that the process in which they are going to acquire new skills and being able to sustain those skills over a longer period of time, so that endurance takes longer. Um, and that relates back also, I think, to the neurodiversity piece of like processing information, recalling that information independently. So when they practice on their own, are they still doing what they think we were doing the day before in a lesson or a session? And so I think there's some tangible, like technical things I might do differently, but mostly what I do differently is how we're processing information and
Mm.
encouraging and really working with people on developing interoception. So that sense of like what's happening inside. I think that's one hard thing with the voice is you can't see how the joints and muscles are moving, right? So it's very much a sensory experience. And people have different philosophies on that, but that's how I approach voice training. Um, so it's a constant checking in. Let's pause. What are you experiencing? And always disclaimer, if you have nothing to say, that's fine. Like it's okay if you notice nothing. And oftentimes people will say, "Oh, I actually don't know. So we'll do it again. And now let's notice this time." But I think noticing and the technical connection being developing interoception skills is really, really important because a big challenge is like recreating the experience you've had in this moment again by yourself. And that's very hard, I think, for hypermobile people. My theory is that that relates back to challenges with proprioception. Um, and also chronic illness being an evolving experience. Each day is not the same. So I think that, yeah, that's the biggest change. And then I think also managing expectations, which relates back to what you mentioned too, Jamie, is um, you might not like suddenly be fine and 100% with this skill in 1 week. You might make progress and then in 2 months, something might set you back and you feel like you're back where you started. So that like steps forward, steps back, sort of like, hills, right? You're like up and now I'm down. So also teaching strategies that you can draw on whenever you need them. Um, that especially comes up for muscle tension, folks with muscle tension dysphonia.
Mhm.
I think similar to how we think about anxiety, it's like, can I just not have this anymore? Can I get rid of this? I don't want it. I don't want muscle tension dysphonia. I don't want anxiety. And one of the biggest things in terms of education is like, I don't believe that that is something you get rid of. I think it's something that you learn to accept and learn to work with. And you will have, ideally, the goal is long periods of it being those things being managed, right? And like not negatively affecting you um, as they are now or in this moment. But but flare-ups is one phrase that might like mean something to listeners, right? These days where things are suddenly back or your symptoms are so much worse. How do you manage it? How do you respond? And can we change the way you're responding so that that period of time where something is flared up is shorter, or the flare up is less intense than it has been, you
Mm.
know, historically? So I think
Yes.
those are the big things. It's like managing expectations, adjusting like learning process and and just like really listening to like what they need that day. So even I might have a plan and it's like, okay, well, this plan is not happening and that's okay. What do you need right now? So I think those are the big three things.
Yeah,
It's so
that's,
good.
oh, sorry, Jamie.
Oh, I was just gonna say it's so good, and I I just was enthralled taking in everything you just shared. And as I was listening, it reminded me of something that I think I'm hearing in what you're saying that I've learned how to do with this population, and hopefully I will continue to get better at this, but tracking progress in unique ways,
Hmm.
right? Like I think when folks come to me, their sense of progress is like, well, can I do more reps, or can I lift more weight, or can I be on my feet for a longer amount of time? Those certainly are possibilities in how we track progress, but there's so many other possibilities. And tracking progress in unique ways so that people feel like they are getting somewhere
Hmm.
because the process is slow. And I want to clarify in case it's not clear. For me, when I talk about slow progress, I'm not suggesting it's because as hypermobile folks, we are, less than, or everyone else is faster than us because they're better than us. It comes down to communication with the brain and
Hmm.
establishing a bank of safety, a bank of experiences where now your body understands, ah, yes, this is okay for us. And each person's nervous system, based on genetic factors, lifestyle factors, history, trauma, etc., we each have a different pace of
Hmm.
communication and learning safety and learning new strategies. And so while that is happening, it can be hard to stay patient and tracking any little bits of progress so that we can see the needle is moving, even though we're going slow. I feel like that really helps the folks that I work with a lot.
Hmm.
Yeah, that's a great point. I think that comes up a lot in voice too, right? Like, I think in the context of chronic illnesses, even if it's not hypermobility, it can be so frustrating if you have a setback or if you're still not at the point that you would like to be. And regularly, every few weeks, I stop. I'm like, this is excellent. They're like, yeah, but I'm still not doing this, this, and this, or like, this is so. I'm like, wait, wait, wait. When I
Yep.
first met you, you couldn't
Yep.
match pitch, right? It's like, and you
Totally.
just like, I used to sing with you because you'd get so nervous about making any sounds with your voice. Now you just sang like a whole piece by yourself without my help at all. And
Oh,
reminding people what they have accomplished, I think relates to what you're
yes.
saying. We're tracking it for them also to take that load, right? We
Yeah.
can like remind them that they have made progress.
Yeah.
Yeah.
I think
Absolutely.
too, with the conversation of slowing down, one, I believe that everyone could use some slowing down. I know that I often need to, and I appreciate, that we are actually speaking in a very like a slower pace. I remember several years ago, I interviewed Jessica Wolf on breathing, and it was such a powerful episode for me because she spoke
Mm.
clearly and slowly.
Mm.
And I listened like I had never listened before. It was so
Mm,
unbelievably powerful. And I got done and I thought, she slowed, her speech was slower and so calm that it helped calm my nervous system as the interviewer. And when I went back and I listened to it, it was like, it was so incredibly profound and powerful because she allowed herself to move slowly through her words and through pace. And a lot of times we speak quick and we're trying to get through something and and when someone comes in speaking like that, as practitioners, we can almost meet them there and slowly start to
Yeah.
slow down to help them also start to regulate and slow down a little bit. And we can do that through our voicing, through our conversation with them, of meeting them where they are and then kind of slowing them down.
Yes.
And so I just love that, what you had just said, Jamie. And then with that, in from a strength training, I'm similar to you, Jamie. I mean, I've learned so much from you. And from a clinical manual component, I do slow movement anyway, so that's not for hypermobile. But a couple modifications I do make. I do not cervical traction anyone who's hypermobile.
yes.
And I think that's really important. So if there are other manual therapists listening, I think that's a very important component. If you have someone who's hypermobile, it is not wise to cervical traction. And I also do different work around the cranium than a suboccipital release. Because in this demographic, a number of hypermobile people have cranial cervical instability. And
Yep.
if we come in and do a lot of work around those suboccipital muscles, and there's a connective tissue from the suboccipital muscles into the dura bridge, known as the myodural bridge, or into the dura mater, this connective tissue, we can really kind of destabilize someone right away by working through those suboccipital muscles. So those are two that I'll just mention in case there are some hands-on practitioners listening.
Mm.
Those are two that I'm going to be mindful of when working with the hypermobile demographic.
Christine, that's huge. I think
Yeah.
that I mentioned I'd been in PT for years because of chronic neck pain before things flared up in my mid 20s into more complex pain issues. But I do attribute my increasing problem as I age to physical therapists doing cervical traction on those like devices and like
Mhm.
causing more injury, exacerbating my thoracic outlet syndrome, leading to surgery a few years ago. So I am so glad you brought that up because I it's really challenging and it's like hard to sometimes feel frustrated thinking back on the damage people have been doing in some ways for years, but also may still be doing, and really reflecting on that like intensity because I find traction to be like a very intense uh, approach, right? Even if you're doing it just with your hands, right? That's not quite as intense as even using one of the devices. But that's something I am curious about for both of you in terms of any like hands-on work. I also do manual therapy myself for head and neck, and gentle touch being so important, starting with simply touching the person and obviously after consent and just talking about what you're about to do, but once you're touching the person, just touching and seeing how they're going to respond and asking, like, what does this feel like to you? And I think there's some practitioners that I've worked with that have found that hypermobile people like really intense touch and like deep tissue. But in my experience, it's not always been the case. And I think that that's why it's important for each person to just start with a level 0 to 1 from your perspective and seeing, is that a 1 out of 5 like pressure or touch for this person, or is it already a 5 out of 5? Because that sensitivity and that like response to stimulus is different for each person, but can, especially if they're experiencing a lot of pain on that day, can be really intense for them. And also, if they're not used to feeling touched, especially if it's around the head and neck, our neck can be like very sensitive and trauma triggering for people. So I find that that gentle touch piece is especially important for hypermobile people as well. And thank you for reminding me by bringing up the traction because I think that's, yeah, it's very important.
Yeah, gentle touch I definitely used to be more heavy-handed than I am now, but that's because of the amount of trauma that I see now versus when I first began.
Yeah.
But I also view hands-on work, two things. One, we don't know how much we're actually releasing tissue through research. We don't know how are we releasing tissue? How much are
Yeah.
we, quote, releasing tissue? We don't know. But what I view hands-on work is a conversation with someone's nervous system,
Yes.
and I'm able to draw proprioceptive and interoceptive awareness to an
Mm,
area in which I am touching. And therefore, I am not trying to manipulate tissue. I am not healing someone's body. I'm not a magician, and I'm not a healer, but your body is.
mhm,
And anything that I can do to draw the brain's awareness to an area that could be beneficial, that's my intention
Mm.
in hands-on
mhm.
work. And that's what I teach in the hands-on course that I do, Amplified Voice, is helping to gain some proprioception, some interoception, having that conversation with the nervous system, especially because I'm teaching people to work around such a vulnerable and intimate area.
Mm.
So before we end, this has been so amazing. I had a question come up 2 weeks ago from a hypermobile client, and I thought it was so important because the question was, what can I do to help find more ease and comfort in sleep?
Mm.
Because I know my body heals when I sleep, but as a hypermobile person, I cannot find comfortable positions to sleep. So, are there
Mm.
any recommendations, any thoughts, any comments you have on how to help hypermobile people with more effective sleep? Mairin, we'll start
Yes.
with you.
I feel like I should qualify this response though with I'm not someone who's like read research on sleeping for hypermobile people. So this is my like well,
And is there any that even
disclaimer.
exists? I'm not sure.
Exactly. And so this is sort of personal experience and also like clinical experience in that like the clinicians I've worked with in a personal capacity. That's what some of these recommendations are from. So I think it's take some of these recommendations with a, oh, I wonder if this could help me too. This is not like a rule that any rules I'm not suggesting. They're just ideas and musings. Um, some things that I found, and I have recommended some of them to my clients, so I'll mention if they've been found useful. One of them is removing pillows from under your head. So, and I'm thinking about like especially head and neck pain issues and how that disrupts sleep. Also, like sleep apnea issue, breathing during sleep. Uh, Pillows, in my observations and experiences, add to breathing interruptions during your sleep, especially if you sleep on your back. The pillow is just going to literally position the inside of your neck in a way that closes off airway more than opens it. And if you think about, if you've ever taken a CPR class, what do they teach you about positioning the head before doing airway rescue? You have to slightly tilt back the head, right? So pillows are always pitching our necks upward and forward. Um, and this some pillows, right? I think that like if you really love pillows for your head, it depends on the person, but a downside style pillow can be something to try because if you can have it actually mostly flat under your head to have your neck in a more neutral alignment, the shape then cradles the side of your head for that proprioception so that you don't feel like your head's gonna just lie to the side and then also be in a uncomfortable position. So no pillow slash objects next to your head to give it some stability and sense of proprioception are something I've never heard from anyone else except myself. And so, but I've had clients who tried it and they're like, my neck pain went away within like a couple of nights. And personally, I will do it sometimes. Sometimes I just want this feeling of a pillow. It's like a comfort thing. So I will go back and use my pillow, and it's no big deal. Some nights I will, sometimes I won't. But I know that it makes the biggest difference if I'm side sleeping, right? Uh, I will bring a pillow in because that's like impossible to sleep on your side without pillows. But back sleepers in particular, try no pillow. The other thing I was just talking about with my PT, she's amazing, really, really skilled, and the only person I would ever let dry needle me. Talk about an intensive intervention. She
Hmm.
is the most gentle dry needler in the world. I don't even know how that's possible. So I can share her information so we can celebrate her later. But she brought up, I have to remember what the product is called, but it's basically like a sleep pod thing. It looks like a sleeping bag, but it's just like thin sort of jersey material. And it's the idea being, can you provide a sense of like where are you in space? Not just where your body's against the mattress, but everywhere else too. And it's like long enough that it can like come over your. I'm also gesturing again. What? It can come up over your feet. So your feet can be closed in or they can come out. So there's two options. And then also it can like come up and kind of come up around your head a little. Um, so I've tried that and I found it nice sometimes because each night for me is different in terms of what helps me sleep. Um, and then mattress being too soft, and I'm curious about what you two will say about this. But if it's too soft, my body will be sleeping in a hyperextended position.
Hmm.
Especially because I end up on my stomach frequently. I sleep in all positions and I end up on my stomach as the night goes on. But if I'm on my stomach, I am like in a U shape or like a what's like I'm trying to think of what the yoga position would be where you're like on the floor and you've lifted your feet and you lifted the front of your head. And I wake up, I'm like, why does my low back hurt? A too soft mattress will contribute, in my experience, contributes to that. And I find that also more common with memory foam because it will conform to the position that your body like will default to. And the default for hypermobile people is not always the most sustainable position.
Hmm.
So I can stop there. Pillows are a big question. Try out different pillows. And then also, like, is your mattress too soft or too memory foamy? So I'll
Yeah,
stop
I'm also a huge advocate of having different pillows. I have a body pillow for side sleeping, a
Oh,
pillow for
yes.
side sleeping, either a very thin or I've even
Yes.
used like a travel pillow where I have part of it under my neck, not my head, and then the other part's on my side.
Yes. They do that
And
for
then,
babies in the NICU. They'll
yeah,
give them like these little rings, and so your head is in like a stable position because the baby then won't like roll their head around too much when they're on their back, but it like keeps it in a neutral position. Why are we using big pillows under our heads?
I
Anyway.
know. I thought when you were saying that, I was like, gosh, we have donuts for when we hurt our tailbones. We should have like head donuts, is what we should be
Great idea.
sleeping with.
That's a
If
really
it
good
doesn't
idea.
already exist, we are creating
So yeah, we
Oh.
apparently we have to trademark this immediately. Someone's gonna start this pillow industry.
it. Jamie, how about you?
Yeah, so I think about sleep um in terms of what's possible at night is probably a reflection of what has been happening throughout the day or what has been happening throughout someone's
Mm.
life. It's
Hmm.
kind of like how we talk about meditation, where we need to practice other times than the moment that we most acutely need it.
Hmm.
Oh,
And
interesting.
so,
Hmm.
yeah, so with sleep, part of the way I am approaching this question is what helps the body and the system feel like downregulating is even an option, or that downregulating is even safe. Because a lot of bodies learn that the only way to be safe is to stay upregulated. So,
Mm.
um, this my my first recommendation, I really appreciate, Mairin, how you said these are offerings to consider, within your available resources, within someone's preferences and comfort, etc. And so I will say the same goes for me. But I would actually start with get your hormones checked and get your blood work done
Mm,
because the nervous system of someone living with a connective tissue disorder, again, it's all on a spectrum, but a nervous system that is more likely to arrive at upregulation easier, that's going to have an impact on nutritional absorption, digestion. We know the digestive system is already in a possibly compromised state. And a nervous system that's more upregulated is also going to have an impact on our hormone profile. And I completely agree. Pillows, appropriate mattress firmness, absolutely yes. But in my experience, these things will not trump if I have no progesterone.
mm,
These things are not a replacement for I have no B12, which is really common in our crowd.
hmm.
So, if possible, get a sense of what's happening with your inner chemistry because hormone support and nutritional support can be a huge part of feeling like your tissues and your nervous system can rest. Um, yeah, totally agree with you on the pillows and the mattress. A soft mattress is just a nightmare for my body. I end up feeling the feeling I have is that nothing's holding me up. And so I tense versus when I lay on a firm mattress, my nervous system is has this sense of like, oh, there's something doing the work for us, so the tissues can relax. That's how I feel. I think moving before bed is really important, even if it's just 5 minutes. Um, what that looks like is going to be really different from person to person. Laying on your back and doing some gentle pelvis rocks, a few breaths, a few little gentle windshield wiper motions with the knees, maybe some cat cow that could be on the floor or against a wall. We can do spinal segmentation up and down a wall. A little bit of movement before you're still, I think, can help a lot. And then if folks have the accessibility to get into a bath, an Epsom salt bath before bed, if climbing in and out of the bath is not accessible, or if you don't have a bath, another alternative is magnesium oil or magnesium spray that you can put on the skin. Magnesium really helps calm the nervous system and it's best absorbed transdermally. So we can take magnesium in a capsule, and that's totally an option as well. But best case scenario, if it goes through the skin, that's going to really help the nervous system and the tissues. And then last thing I'll say is I am a huge fan of chamomile tea.
Mm.
Chamomile is basically a muscle relaxer, and chamomile also helps downregulate the central nervous system. So a little bit of movement, warm drink, magnesium, hormone support, nutritional support. Oh, I'm sorry, one more thing. Respect your sensory profile, meaning if you know that sound is very upregulating for your nervous system, get the white noise machine. If my husband sleeps in a different room, he snores, and we don't sleep in the same bed because
It's more
sound,
common than
yeah,
people realize. Yeah.
yes. And
Mhm.
it's awesome. It's great. Uh, and I know not everyone lives in a home where they have that option, but if sound is really troubling to your nervous system and you have the option to sleep alone, get your room as quiet as it can be, get it as dark as it needs to be, the sensory profile,
Hmm.
your unique sensory profile is going to have an impact on your nervous system and an impact on how well you can fall into sleep. So I know that was a
Jamie,
lot.
I know,
No,
and I
that's
love you
wonderful.
listed all those things. I feel like it's like this great summary of sleep hygiene. Like, because there's good research on sleep hygiene stuff. There's also, the blue light, right? Exposure to your phone and those stimulating experiences, and how can you reduce that? The one thing I would love to add, because you made me think of it, is breathing, right? And how much breathing relates to our nervous system, and right, finding that sense of safety.
Yep.
Um, because when are we going to be able to sleep if our body, if somewhere in our brain, our nervous system thinks that we are having to be alert and vigilant, right? So helping our body realize that we are safe and can sleep. And so, trauma is a complex thing, but breathing can contribute to that, right? Like I sometimes talk to my clients about, well, here's some ways to help you reduce throat clearing. First, swallow. Can you swallow? Good. Then you know you can swallow. Things are moving in there. Second of all, try humming. Does your voice turn on? That means your voice is working and nothing is actually sitting on your vocal folds. So similarly in sleep, right? Can you breathe? Are you breathing? That means you are alive and like everything's okay. You're not
Yeah.
having a health crisis.
Yeah.
Second, like in your environment, like are things in a stable state in your environment? Great. It's like this checklist of like reminding yourself consciously, are things okay around me and like mostly okay in my body? And taking that moment to then inhale and exhale. Nasal inhales, as you both would know, but listeners, like your nasal inhales are going to be more effective in that setting, not necessarily in singing all the time, but they're more humidifying and better in terms of like that gaseous exchange in the respiratory system. So you're going to get a really nice breath, inhale through the nose, out through the mouth, and really letting that exhale be longer than the inhale. Because when they're equal, or if the exhale is shorter than the inhale, your body thinks it's in a state of flight and freeze and that upregulated nervous system. So inhaling and that exhale being nice and long and slowed down. And it might not happen immediately in the first breath, but like that kind of focus be so helpful in getting your body into a resting state and ready for sleeping.
Yeah. And I I think in the way that you phrase the question, Christine, that your listener or client, I can't remember who you said it was, but that they were more so asking about sleep position.
Mhm.
And and I the reason I didn't address that directly is because I just tend to think more about what's upstream. I
Mhm.
feel like
Mm,
sleep position is just a little bit more downstream, and that it's probably easier to find a position that feels good when some of these other things are on board. So I
Mhm.
realized that I didn't specifically respond to the question as it was asked, but I had a reason for that.
No, I appreciated the way that you answered it. And then Maren, when you came in, because I was about to also say, and of course, what do we do a lot of times before bed? We watch TV or we scroll through social media,
oh,
which is just a
I
lot of
know.
sensory information. So
Yeah.
anything that we can do to help our nervous system downregulate a little bit
I
before we
have
go to
like
sleep.
10 more ideas too right now, and I I feel
We
like
should
there
do a
needs to be a
sleep
whole episode
episode.
on sleep
Oh, yeah.
Yes.
because I think sleep's also affected by what we do during the day. Have we, like the revenge scrolling is an interesting term that I don't have time to get into right now, but and thinking about like, have you made time for yourself to do the nothing task that you want to do of just like zoning out? If there's no time to do that during the day, that might be why it's happening at night. So, I don't know. We can come back and do a sleep episode.
Yeah, sleep is so important. I mean, there are books and books written on the power and the importance of sleep, but at least
Mhm.
being able to touch the surface today, I thought
Yeah.
was really important. So before we go, I would love for each of you, if there's anything else that you would like to mention to the listeners, any way that they can get a hold of you, anything you might have coming up that they could meet you at, join, take, whatever. I would love to take the opportunity to let the listeners know. So, Jamie, let's start with you.
Yeah, I, along with my co-creator, her name is Bo Campo, we are launching a course. It's available, like sign up is available. The course starts June 21st, and it's called Yoga for Hypermobility. It's a 6-week course that we specifically designed to help support folks who are living with hypermobile spectrum disorder or EDS, Ehlers-Danlos syndrome, learn how to love yoga again by practicing it in a way that it meets the body where it's at, not us trying to fit the body to make a shape. Um, I'm really excited about this. I've been practicing and teaching yoga for a long time, as you mentioned in the beginning, in my bio, and yoga has the potential to be such a beautiful modality for us because of that possibility of calming and having some community, moving slow. Um, but I have been kind of dissatisfied with most of the yoga classes that I've been to, and that's not a
Mhm.
it's not a criticism or condemnation of anyone. It just showed me that there's room for evolution and growth. So yoga for hypermobility, 6 weeks. Bo and I are going to just discuss what is yoga, what is hypermobility, where do they cross over well, where do they cross over in ways that might not be so helpful, how to cultivate a different approach to common poses, and how to advocate for yourself in a yoga space and know how do I know if I want to stay? How do I know if this is not safe and I should go? We're going to
Mm.
cover all that and more. We meet twice a week, and if folks are interested, you can check us out on Instagram. We're at hypermobile_yoga, and there's a link there to check out the course. And if the course is not an option for you right now with resources, we'll be sharing free stuff on Instagram.
Great. Thank you, Jamie. Mairin?
Jamie, I want to go sign up right now. It sounds
Please
great.
do.
I where should I start? I guess, well, I don't have any programming like class that's ready to sign up for. Most of my practice is one-on-one work, and so you can find me at my website, masvoice.org. And I am someone who will talk to you even if I can't help you on a long-term basis because I love collecting my list of people to refer you to if there's someone, if you're like far away from me or if you don't want to do virtual work, but I will chat with you virtually or on the phone to help you find resources that you might need or be looking for. Um, I think that, one of the big questions that I think about is who's taking care of you, right? It comes back to that theme of who's on your care team. Do you have people taking care of you? And one practitioner doesn't have to be it. Um, get your body worker, your personal trainer, your acupuncturist, your floating location, your what else? Your PT, your all those people. I have a whole list of people that I see. Those are just some of them. And so I recommend that you have that, but also it's not possible for everyone to have that kind of large team. And so I guess I can just say that I'm someone that you can reach out to if you're listening, and I'm happy to try to find you the support you may need. And I offer sliding scale services to make sure that resources and having a space to address your concerns can be available. So I'm just so happy to have been here. Thank you, Christine.
Yeah, my pleasure. How can they get in touch with you? Did you mention?
Well, my website's the best way probably because
Okay.
you can book a time there, and you can also follow me on Instagram. MAS Voice is my handle. And yeah, I'll be excited to hear from you either through Instagram, through my website, where my email and my phone number are listed.
Awesome. Thank you both so much for coming on and having this conversation with me today. I'm so grateful to both of you for taking the time to be here. I know we all have busy schedules, but I think it's a very important conversation. I know the listeners will be really grateful to have this as one of the episodes. And also, I just think I don't often do, more than one guest at a time. I've only done it a few times, probably a handful of times. But part of what I really love about it is the dialogue and the feel. When we're in an interview of one of two people, it's a conversation and it's really lovely. But to have more than just two people is very community based. And so I've been sitting here during this time just so grateful that we were able to spend this time together in our small little 3-group community, and then of course be able to share that with the larger community of the listeners. So thank you for being here. I'm so grateful, and yeah, I look forward to seeing you both again and checking out all of your offerings. Thank you everybody so much for listening. Grateful to have you here. We appreciate it, and we'll see you next time. Thank you all for listening. If you enjoyed this podcast, tell your colleagues, students, and friends. Subscribe, rate, and please write a review. You can find us on Instagram or Facebook, and feel free to check out my website at www.thevisceralvoice.com for information on programs and upcoming events. I hope you join us next time for another wonderful conversation on The Visceral Voice.